Aufmerksamkeit.
Dankeschön.
Sí.
Okay.
Okay.
Hi, can I have Mrs. Williams, please? Thank you. Hi, good morning, Mrs. Williams. Come take a seat.
Thank you.
So, Mrs. Williams, what's the problem?
Well, I've had this cough for the last 10 days or so, and I really think I ought to have it looked at.
Sure, tell me a bit more about how you're feeling.
I don't feel so good at all. I just feel drained in myself.
Yeah.
And this cough has sort of started in my throat, but now it's sort of gone down onto my chest.
Right.
So I'm really worried about it.
And what worries you most about it?
Well, because it's sort of gone down onto my chest, I'm bringing up some white stuff I'm wearing in case it could be something more serious.
Well, look, I tell you what, let me take a really good look at you, and then we'll talk a bit further. If I could have you up on my examination couch over there, that'd be great.
Okay.
Look, the main problem is that we use antibiotics too much. People are getting antibiotics prescribed for them when there's no chance of them benefiting from that antibiotic treatment. The more we use antibiotics, the more antibiotic resistance develops, and that could mean that as we go along, we have no effective treatment for a lot of infections. So, Ms. Williams, I've had a good look at you, and from what you tell me about this cough, I'm pretty confident you don't have pneumonia or pleurisy.
Oh, that's okay then.
Right. Regarding treatment, did you have any sort of ideas about what would be good?
Well, I thought maybe I might need antibiotics.
Okay. In most consultations, the doctor and the patient don't mention antibiotics. The doctors are thinking, wow, this patient wants antibiotics. Well, can I get away with not prescribing it? There's a delicate dance around the issue of antibiotics. No one lifts the lid. No one mentions the word antibiotics. There's an elephant in the room. And what I kind of try and promote is that, well, let's ask the patients, how do you feel about antibiotics? Is that what you really want? Because there are other things that could help you more. And, you know, here are the risks and the benefits of the antibiotics. So if you have an open dialogue, shared decision making, we call it, I think that this problem will be much, much improved. You know, for people who have got a cough like you have, the evidence is that antibiotics don't help you get better any quicker. Yeah, and I don't want to frighten you about antibiotics, but you know, you can get things like an upset stomach or diarrhea and thrush and things like that from antibiotics. So the evidence is that, as I say, for people with infections like you, antibiotics aren't going to help you much at all. And in fact, the chances of being harmed by the antibiotics are much the same as the chance of benefiting from them.
Well, as long as I haven't got pneumonia or pleurisy, I'll be okay.
Yeah. If you get any worse, by all means, come down and we'll have another look at you, okay? Okay, great. Well, good to see you, Mrs. Williams. You take care now, hey?
Yes.
All the best.
Thank you.
Bye now.
Bye-bye.
discussie terug opnieuw. Terug van nul begonnen en schrijven. Ik vond ze niet goed.
De discussie van nul begonnen. Hand aan het leggen.
Ja, ik wil mijn discussie terug.
Klaar hebben, discussie. Al een maand of zo.
Ja.
Je hebt een stijl van GCM geschreven.
Ja.
Okay. All the specimens from all over Europe are sent to us, and we analyze these specimens from patients with respiratory tract infections with acute cough for the presence of viruses and also bacteria. So in this machine we extract the DNA, for instance, and then afterwards we will amplify the DNA and see what kind of organisms are causing these symptoms of acute cough in these patients in Europe.
Virus erin, dus er geen signaal zit het virus er niet in.
Simplistisch mogelijk.
Ja. Ja.
Ja, ik kan het zien met hè. Is het verbieden soms? Ja, dank je. Ja, want, no. I think in the short term we need to fund research projects which are providing the evidence to change antibiotic prescribing. But in the long term we do need new antibiotics. And so we have to help the industry to develop these new antibiotics, but also develop rapid molecular diagnostic tests.
We've shown in the GRACE study that huge variation in antibiotic prescribing makes very little or no difference to the outcome of patients. They're going to get better whatever we do. And if patients understand that, they're not going to want to take antibiotics that aren't going to really help them and may harm them.
I mean, it's watching TV for
There's a lot of people who get quite depressed about this, and they think that the rise of antibiotic resistance is a relentless thing, and whatever we do, there's nothing we can do about it. But we've shown in a study here in Wales of over 2 million people where we followed them for 7 years that if we reduce antibiotic prescribing by general practices, that we will reduce the levels of resistance in the samples that those practices send to the hospital.
Zal dezelfde minuut duren.
I think Europe is really taking the lead in the world, and that is thanks to, for instance, DG Research funding a lot of research projects which give us the evidence we need to change antibiotic prescribing and also to understand the dynamics and the spread of antibiotic resistance.